Hello, everyone. Welcome to Food Integrity Now. I'm excited to have this wonderful guest back again, Dr. Dale Bredesen. Dale, welcome.
Thanks so much, Carol. Thank
So,
you.
I would like to have our audience know a little bit more about Dr. Bredesen. I have interviewed him 3 or 4 times in the past, but in case you missed those interviews, I think it's worth noting that he is, in my opinion, the leading expert of anybody in the world on Alzheimer's and neurodegenerative diseases. So I'll go ahead and read his bio. Dr. Bredesen is an internationally recognized expert in the mechanisms of neurodegenerative diseases. Dr. Bredesen's career has been guided by a simple idea that Alzheimer's, as we know it, is not just preventable, but reversible. Dr. Bredesen's dedicated pursuit of the science that makes this a reality has placed him at the vanguard of neurological research and led to the discoveries that today underline the RECODE protocol. And we'll talk further with you in the interview about what that is. Dr. Bredesen earned his MD from Duke University Medical Center and served as chief resident in neurology at the University of California, San Francisco, UCSF. He held faculty positions at UCSF, UCLA, and the University of California, San Diego. Dr. Bredesen has directed the program of aging at the Burnham Institute before joining the Buck Institute in 1998 as founding president and CEO. Dr. Bredesen's research explores previously uncharted territory in explaining the physical mechanism behind the erosion of memory seen in Alzheimer's disease and has opened the door to new approaches to treatment. This work has led to the identification of several new therapeutic processes that are showing remarkable early results. Dr. Bredesen is a prodigious innovator in medicine with over 30 patents to his name. Notably, he put much of the findings and research into his 2017 New York Times bestseller, The End of Alzheimer's. I interviewed Dr. Bredesen about that book and also the End of Alzheimer's program. So you can find both of those interviews on Food Integrity Now. In his book, The First Survivors of Alzheimer's, he presents the stories of 7 individuals who reversed their cognitive decline using the RECODE protocol. Today, I'm going to be talking with Dr. Bredesen about his brand new book, The Ageless Brain. And this has only been out a week or two, isn't that correct? Yeah.
Yes.
So I'm super excited to have a conversation about all this latest and newest information. So I think I would like we're going to talk about the RECODE protocol and what that is so our listeners can understand a little bit more about that. But I would like to go over the basics first of why Alzheimer's is, we all know somebody who has it or dementia, and why this is so. And I know this is a big question. What are some of the key contributors to this? And I know it's several things, but what do you think some of the key are, Dr. Bredesen?
Yeah. Great point. And as you indicated, the new book is really about saving brain cells for all of us. So in the past, we've written mostly about Alzheimer's. This is really saying for all of us, how do we make sure that our brain span is equal to our lifespan? I often will be talking to groups and say, well, who wants to live to 120 or 140? And people will say, yeah, with this interest in anti-aging that's current. And I'll say, and spend half that time in a nursing home with dementia. Of course, nobody wants to do that. So we want to do everything possible to make sure that people have a brain span that is equal to their lifespan, that for their full life, they will be sharp and have good, good memory, good cognition in general. And so we spent 30 years in the laboratory looking at what are the molecular processes that drive that change as we begin to age. And what is brain aging all about? What's causing your brain to not be the same at 75 as it was at 25? And one other piece, when does that start? There are some really alarming statistics where recently people were looking, a research group was looking at uh, laying down memory, 18 to 25-year-olds, with and without exercise. They were trying to look at what happens to laying down memory. And what they found was they could see differences in memory storage in people who had the common Alzheimer gene, ApoE4, at 18 to 25 years old already. Even though we think of this as an, quote, old timers disease, these are changes in the brain that are going on in your 20s, 30s, 40s, 50s, and therefore we want to optimize these things. Now, you asked about what are the things that are driving this, and that's what we studied for so many years. What we found is that ultimately it's actually pretty simple. Your brain has about 500 trillion synapses. So you have this remarkable brain. You have more ability to store information in your brain than over 2,000 home computers. You really have what is essentially equal to the largest supercomputers in the world inside your skull. Pretty remarkable. What's happened is throughout evolution, we have repeatedly selected for performance over durability. And okay, the organisms that selected for durability were killed by the ones that were selected for performance. So you have this amazing ability. You've got a tremendous neural subnetwork involved with plasticity. That's the one that goes awry in Alzheimer's. When you're selecting for these things, it's like driving a Ferrari 220 miles an hour all the time. You're really operating at the limit of your mitochondrial function, of your synaptic transmission. And this thing has therefore got Achilles heels. There are things that make it not work so well. And so we'll talk about those. Then there's a separate neural subnetwork that is involved with fine motor modulation. And that's what goes awry in Parkinson's. And people fall down and they can't walk as fast as they could before. And they aren't as good with doing that perfect fine motor modulation. They don't have the energy to do that. And in fact, it turns out that the Achilles heel for that subnetwork is mitochondrial complex 1. So you need that energetics to do that fine manipulation. Then you've got another system which is there for power amplification. It's amazing when you come up with a thought and you say, okay, I'm going to flex all my muscles maximally. You go from the thought process that has that idea is approximately 1 millionth of a calorie per second. So you don't burn a lot by thinking I'm going to flex my muscles. But when you then almost instantaneously turn that into an amplification of what you're doing, you go from about 1 millionth of a calorie per second to about half a calorie per second. That's the maximum a human can do with maximal muscle output. That's more amplification than you get from stomping on your car accelerator. So we have these truly remarkable, finely tuned systems in our brain that are unfortunately therefore subject to loss of durability, and we've got to take good care of them. And so when I was training many years ago, and I'm now in my mid 70s, when I was training many years ago, we were taught their armamentarium is zero. There's nothing you can do about these things. Now we know much more about what's actually driving this loss, and therefore what we can do to prevent it and reverse it. And of course, the earlier you start, the easier it is. When we see people in the very late stages, we can get some improvement, but we cannot yet get them all the way back to perfect. That's one of the things we're interested in as far as how do we push it. In our trial, though, 84% of people got better. We're in the midst of a randomized controlled trial now, 6 different sites, and people are getting better. It's beautiful. The interim analysis of the data, very exciting. And this is going to be completed in October. So when you look at this, what you find is these demanding subsystems, they need a lot of energy. They need a lot of support. So you have a supply and you have a demand. When you're young, plenty of supply, not too much demand. As you begin to age a little, things that are inflammatory, they put drag on this. So changes in your oral microbiome, leaky gut, tick-borne illnesses, poor blood flow, all these things, metabolic syndrome that gives you inflammation. These things start to increase the demand. Then exposure to toxins like air pollution and things. You now got to detox this. Suddenly, you're out there trying to do more things. The demand is going up. Meanwhile, the supply is going down. Your blood flow may not be as good as it once was. Your mitochondrial function, your oxygenation. So people who have sleep apnea are at increased risk for cognitive decline. It's a common one. And then exposure to glucose and getting insulin resistant and exposure to high fructose corn syrup and things like this. These give you multiple problems. They cause the inflammation that increases the resistance side, the demand side, but they also reduce the supply side because you're now becoming insulin resistant. You're now not able to make the ketones that you need. You're not metabolically flexible. So as you know, a human brain is like a Prius. It's only got two fuels it can use. In this case, it's not petrol and electricity. It happens to be glucose and ketones. And so as we get past 40 often, we now are losing the ability. In fact, if you look at a PET scan of someone who's getting Alzheimer's, that's exactly what you see. Reduced glucose utilization in the temporal and parietal regions. So you're now sputtering because your insulin is going up to take care of that insulin resistance. Now you cannot, with that high insulin, you cannot make ketones. So now you're really sputtering. You've got the kind of the worst of both situations. So one of the first things that we do when we are treating people is return insulin sensitivity and return ketones. And at the beginning, we just use exogenous ketones, but ultimately we can get people to be metabolically flexible so that they can burn both of these.
So
So
you do that through a ketogenic type
yes,
diet.
plant-rich, mildly ketogenic diet with high phytonutrients and with high fiber and with appropriate periods of fasting so that you can get metabolically flexible. But you have to remember there's a paradox there. We're dealing with a network insufficiency. So you don't want to just jump in there and say, have a long period of fasting. That just makes things worse. So we want to be very careful. That's why we start with some exogenous ketones. And now we're getting you back into insulin sensitivity. These things are important to fuel an optimal function of your brain. And by the way, for people who don't have cognitive decline, you'll notice you improve. You'll still notice that you are sharper than you were when you optimize these various parameters. I just got off with a person a few minutes ago having issues, has not checked yet for sleep apnea, but has all the symptoms of it. This should have been checked before. In the United States, about 80% of sleep apnea goes undiagnosed, and it's unquestionably a key contributor to cognitive decline, to brain aging itself. Dropping your oxygenation at night is not good. Increasing your adrenaline at night, which is what happens. People will have dreams. Oh my gosh, I'm running. I can't catch my breath. Yes, it's telling you something. And then, of course, what happens is they're on a poor diet. So what happens when they go to bed? Their glucose plummets. And we have it all the time when people do the CGMs, the continuous glucose monitoring, they'll wake up at 3 or 4 in the morning and their glucose is 42 or 45. They're really hypoglycemic and not realizing this. And they're not able to make the ketones because of their insulin resistance.
I
So
have
the
a
bottom line
question.
is anything.
I want to just back up just for a second. When you mentioned sleep apnea, one
Yeah,
of the things that I have been doing, well, I was monitoring myself for a while. My sleep is pretty good, but I noticed because I had some sinus issues, which I've rectified, that I was sleeping with my mouth open,
yeah.
which was problematic. So now I tape my mouth shut. And that really seems to be helping. And I've noticed that on nights that I forget to do that, I've kind of retrained myself to sleep with my mouth closed.
Yeah,
So
good for you. Yeah, that
what is your thought about that? I just curious.
Well, there's no question, and a lot of people do that. If you're able to get away, you're lucky because some people aren't able to get away with that because they just can't breathe very well through their nose. So
Yeah,
if they tape their
yeah,
mouth shut, they'll wake up and say, "Oh my gosh, I got to open my mouth."
yeah,
But if you can, that's so we think of this for all these things. We want to do what is most physiologically appropriate, and I should say the entire field. That's what's happening. The field has been dominated by pathology. You have amyloid, you have tau, you have alpha synuclein. It's been about pathology. Let's create antibodies to rip that stuff out of your brain. It really makes no scientific sense. We're switching now to physiology. What's driving you? What's driving your body to make these things as you age is insults. It's because you don't have enough enough sleep. It's because you don't have enough hormonal support. It's because you don't have enough nutritional support. And you could argue that nutrition is probably the number one problem when you look at all the things driving aging and specifically brain aging. So your body is responding. It's not trying to give you a disease. It's trying to respond to these insults. And so we typically think with sleep apnea, yes, start tape it shut. That's the beginning because you're breathing through your nose. You're going to get to be better in terms of your vasodilation. You're going to get more in terms of nitric oxide.
right.
You're going to get more in terms of warmed air. So you're going to do better in terms of your overall diaphragmatic breathing. So there are a number of these. And of course, you're going to have a better oral microbiome because mouth breathing causes a change in your oral microbiome. And by the way, it causes a classic mild chronic gingivitis. Recently, there were studies of the brain microbiome. I mean, I was taught years ago the brain is a sterile organ. There's no such thing as a microbiome in the brain. It turns out that was wrong. There is not only a gut microbiome, a skin microbiome, an oral and sinus microbiome, there actually is a brain microbiome normally. And there are some changes in that with Alzheimer's and Parkinson's and things like that. But when you look at that brain microbiome, guess what the organisms are? They're largely the organisms that are in your mouth and in your nose and sinuses. So that tells you a lot. There is some sort of communication here. It's been known for years that a particularly bad actor for periodontitis called P. gingivalis is affecting the brain and is a risk factor for cognitive decline and for Alzheimer's disease.
Wow.
So there is a communication here that you have to be aware of. And having that dry mouth and the change in your oral microbiome, I really like oral DNA is a good one. Bristle is another good one. Find out about your oral microbiome. There are all sorts of wonderful rinses, things like Dental Side and Stella Life and things like that. There are now oral probiotics. I'm very interested in seeing the first brain probiotic.
Yeah,
I've not seen it come
I
yet.
take the dental Sidon
Yeah,
oral
great.
probiotic. Yeah,
Yes.
I love biocidin products in general,
Yeah.
and I use their toothpaste. And when they came out with that, because I've had teeth issues, which I've had rectified, but
Yeah.
I figure it can't hurt.
Yeah. Yeah. No question. And so there's no question that getting you an optimal microbiome in your gut, in your nasal passages, sinuses, and in your oral cavity are all very important. So when you ask, what are the things that drive it? It's anything that reduces supply or increases demand. And the big three groups are reduced energetics, toxicity, and inflammation. And so we look for different pathogens. Herpes simplex is a classic one. And people who don't treat their outbreaks are at increased risk for cognitive decline. There's been beautiful lifelong work by a professor in the UK, Professor Ruth Itzhaki, who has shown that herpes simplex is associated with cognitive decline. And the study that came out of Taiwan was really surprising. People who treated their outbreaks of lip herpes, cold sores basically, had more than a 50% reduction in their risk for developing Alzheimer's.
Wow, just for treating it.
Striking, yeah. So whether you like valet, cyclovir, suppression, whether you want to make sure to put on some block when you get out there, so that you don't, if you get out in the sun, you don't increase your risk for these cold sores. Obviously stress related, all these sorts of things, keeping those to a minimum, and even suppressing them for some time is really helpful. And we do this as part of our overall randomized controlled trial. We do make sure that people don't have herpes outbreaks, because they do in many cases. Anything that is driving brain inflammation. And of course, this goes up your trigeminal nerve, which can then actually project right up near your temporal lobe. So you have a root for these things. They can basically go both ways from the ganglion cells. And you got to be aware of this. The physiology of what makes a human body work and a human brain work is truly remarkable. And people are finding out more and more about hormonal optimization and diet optimization, and what is really helpful for you to eat and what is not so helpful for you to eat. One of the big ones recently is microplastics. And the results are not all in yet, but here's what we do know and here's what we don't know. We do know that it's going up. There's more microplastics in our brains than there used to be. We do
Yes.
know that these accumulate in your brain more than your liver, more than your kidney, which was somewhat surprising. I mean, we think of liver as a place to deal with toxins. Well, these things are in your brain more than those organs. And we do know that they are associated with cognitive decline. We don't know yet if it's causing the cognitive decline or if it's simply a result, or both. But no question they're associated. And so people are looking to things like plasma exchange to have dramatic reductions in their overall body burdens of microplastics. And maybe not such a bad idea to
Yeah.
get these things down. But of course, for all of us, just live healthier, and do general detox.
Get rid of your plastic water bottles. Store your food in glass, and just some simple things can, I'm sure, make a difference.
And don't microwave in plastics. And if you
I
don't,
I, I say don't microwave anything. I
yeah,
don't I don't
yeah,
use my microwave at all. But yeah, I just that's kind of been one of my pet peeves lately is, people just drinking out of water bottles all day long. And
yeah,
they let them sit and they reuse them sometimes. They put them in the dishwasher, and that makes it leach.
yep.
And
So,
anyway, that's a simple
water on a glass, exactly.
water out of a glass. Absolutely. So you had mentioned a little bit earlier about you're seeing younger people develop
Yes.
cognitive decline. So this is a two-part question. How young do you think people need to start really paying attention to this? And what are some of the things that those who choose to, make the effort to so that they don't have cognitive decline? What can they start doing right now?
This is a great point. And the epidemiologists have published this. This isn't something that just I've been seeing. It's something that everyone's been seeing. When I was being trained in neurology, we never saw people in their 40s and 50s who had Alzheimer's disease. Now it's one of the most common things we see. And the epidemiologists have shown that it used to be a disease, so-called old-timers disease, where nobody had it when they were young and everybody was in their 70s, 80s, 90s. Now it's like this. Yes, we still see it in older people, but the area that's growing the fastest in terms of year over year is actually the 30 somethings and 40 somethings. So, and this is actually in the book that you mentioned. We
Yes.
go over this. And so people are trying to understand, why is this? And it looks like there are a number of reasons. Part is the change in diet that has occurred, with more processed food, more high carb food and things like that. And so that seems to be part of the reason. And we're exposed to more toxic environments than we were in the past. That seems like
EMFs and people sitting longer on their computers, those are all contributors.
yeah, and there's a lot we don't know about that, but we do know that whatever's happening, the supply is going down and the demand is going up. And so you're getting these problems early. I mentioned, now that there's more and more biochemistry, people are looking at these earliest changes. So there is a new blood test that everyone who's 35 or over should consider strongly. I had it done right here in my kitchen, not just a couple of weeks ago. And happy to see that this came back fine. I will recheck it in a couple of years. I recommend that everyone get it checked every 5 years if you're under 60. Once you hit 60, you want to check it every 2 years. This is called brain scan, and although it's called brain scan, it's a blood test. And what it tests is three things: p-tau 217, GFAP, and NFL. And here's the way this works. When you have the lower supply and the increased demand, when you're kind of going on the wrong side of this, what'll begin to happen is your tau, which tau is something that stabilizes your microtubules. So when you're doing well, you got plenty of supply, not too much demand, you're able to make neurites grow. You're able to make connections, keep connections, all that good stuff.
Is that
Now,
like BDNF?
well, the BDNF influences that. That's right. So
Okay.
that will
Yeah.
influence this process and help you to get that growth.
Okay.
When things are bad, when you've got inflammation and poor food sources, and you've got air pollution, California fires, one of the issues, all these things, you literally switch, just like you would switch from sleep to wakefulness, you switch from connection to protection. You now have to put your resources into protecting yourself. And so what you do is you phosphorylate your tau, it pops off the microtubules, and now that phosphorylated tau is actually an antimicrobial protein. So it changes its job. It's really remarkable. And you can pick up that phosphorylated tau in the blood. So this is a simple blood test. You look at the amount of phosphorylated tau. That tells you, are you on your way toward Alzheimer's disease? Very helpful to know, because you nip it early nip it in the bud, and you don't ever have to get the dementia. The bottom line is, with everything we know now, nobody should be getting dementia. This should be a much more rare problem than it currently is. 15% of our population dies. 45 million Americans of the currently living Americans are slated to die of this.
Yeah.
We could really,
How do
really
people find these tests? Because I know that's, people.
simple. Go on. You can actually get it direct to you. Just get a brain scan. Go to getabrainscan.com, or getabrainscan.com is the easiest way to do that. And then, if it's abnormal, don't worry. There's somebody there to talk to about it. And actually, I can weigh in on this as well. And we've got a report for you. So we kind of put this out there so that people don't have to wait. They wait too long. Unfortunately, that's been a big problem. It's like waiting to treat diabetes until you're in ketoacidosis. It just makes no sense.
Okay.
The second test is GFAP. That's also part of this brain scan. GFAP, glial fibrillary acidic protein. And that is looking at whether you have inflammation and ongoing repair in your brain, if you've got some inflammation. So it's very much complementary. It's not specific for Alzheimer's, but it will tell you whether you've got inflammation going from anything. And then the third test is called NFL, neurofilament light. That's also complementary. That tells you, that will tell you whether there is damage to neurons from any source. Have you had a car wreck? Have you been playing too much football and getting hit on the head? Any of these things. Do you have a different degenerative process, or do you have Alzheimer's? So when I see people who are beginning to develop Alzheimer's, their p-tau will be up, and then when it's active, their GFAP and NFL will also be up. When they are doing better, these others will be down, and if they're relatively quiescent, the p-tau will be only a little up, and we can ultimately see the p-tau come back to normal if they're treated correctly. And people do very, very well. So the whole point of the book is, let's get people to make sure that they have a good functional brain for their entire lives. You no longer have to wait for these late situations, late phases, and then have your doctor tell you, oh, there's nothing we can do for you. There's a tremendous amount that can be done, and the earlier, the better. So we recommend that anyone who's 35 or over, please get evaluated, please get on active prevention. Or if you have symptoms, get on earliest treatment. Although they've shown these changes in the 20s, I don't think you have to worry about this in your 20s. But 35 or 40, right in there is when things start to change. You can see it biochemically. And so find out, don't worry about it. That's the other thing. People say, well, I don't want to know. Well, actually, you're going to have a much happier life, better life. Again, just like don't wait for full-on diabetes. Find out if you have pre-diabetes and get rid of it.
Yeah.
And you'll never get diabetes. And let's make sure that people don't get dementia.
So I have a question about these tests. Is this something that most people's insurance would cover, or are these outside of that?
So
Uh,
yeah, that's a great point. For most people, this is going to be outside of insurance because insurance, of course, insurance makes money by denying to give you what you need. It's
right,
going to take
right,
some time for people to say, look, this is a really important test. And there are some insurances that are going to come through for this. So there will be some that will do it. But for most people, here's my argument is this. If you don't do it, then you're going to pay much more later when things get worse. So this is why the average American, unfortunately, before dying of Alzheimer's, pays $350 to $400,000 overtime in nursing homes, costs for physicians,
right.
home care, all these sorts of things. It's horrible. You can save 90+% of that by getting the appropriate tests, finding out where you are, making sure that you never have a problem. So that's the future. And I hope that the insurance companies will recognize that. So far, what they're saying is, we're not going to be insuring you forever, so we don't want to help you out, which is really sad. I hope.
Yeah, it is. But it can't hurt to ask. I asked I have just a MD doctor,
Yeah,
not even a functional one, who I just use for, routine blood tests and things
yeah,
like that. And I said, can we test my APOE? And she was, well, I'll try. And it went through. My insurance
good,
covered it. So
good.
so you never know. You can
Yes,
ask, but I think the point you're making, Dr. Bredesen, is that, even paying out of pocket, you will more than recoup that money back in not paying out to nursing homes if you change your diet and change your lifestyle and do all the recommendations if you have an issue.
yeah, exactly right. And the very first person where we reversed her cognitive decline is someone I saw in April of 2012. And she was 67 then. She's now 80, just about to turn 81. She has done great, 13 years now, absolutely great. And she is walking across the United States to raise awareness that cognitive decline can be reversed. She was patient zero. She was the first one. And we've had thousands since then.
Yeah.
But and so you can see her if you look on judywalks.org and you'll see her walking across the United States. She's just started recently. In fact, we walked the first day with her down in San Diego.
I
Uh,
saw those pictures. Yeah, that's
yeah, she's walking to
wonderful.
Florida. So, and I just was texting with her last night. She's doing great. She's just about to hit the Arizona border. So it's really,
That's
really cool.
incredible.
She's amazing. She's done marathons and bike races. Incredible.
Yeah. Well, it gives people hope too. And when they can
Yeah,
see somebody, that has turned their life around just, by diet and lifestyle, and
yeah,
it can happen. I mean, I do coaching, nutritional counseling to people, and just, changing a few things can make a huge difference
yes. And
in the
the
way you
armamentarium,
feel,
knowing
your attitude about life, your quality of life, which is what this is all about, quality of life, right?
exactly.
Yeah,
Exactly. For the first time, we know what's driving the process. We know what to look for, and we know what to do about it.
yes,
And so, things have really changed with that. And so, everyone can take advantage of that, and have a much better brain span.
yeah. So in the book, do you discuss anything new as far as infections and how they affect the brain, and just is there any new information around that?
Absolutely. So, we think about we think about the various things that will drive this. And as I said, the big three are reduction in energetics, so your blood flow, your oxygenation, your mitochondrial function, sleep out, all that stuff. Second is inflammation. So just what you say, infections. It's changes in the oral microbiome. We see people where they've got a chronic sinusitis. It's mild, but over the years, this is communicating with your brain. Your brain is saying, "Oh my gosh, there's some inflammation here. There's some organisms here." So when you look at what organisms, it's not like tuberculosis where there's one organism and that's the thing that gives you TB. It's many organisms, and it can be viruses like herpes simplex. Another one called HHV6A is a big one. Epstein-Barr virus, things like that. Herpes zoster, which is why, interestingly, people who've had the shingles vaccine have a reduced risk for cognitive decline. So any herpes family viruses are a big one. Then there are things like P. gingivalis, T. denticola. These are the sorts of things that can be a problem. And then there are fungi, things like yeast, like Candida, mold species,
Yeah.
and they can get into the brain and can produce toxins where the mold doesn't have to get into the brain, but the toxin itself gets into the brain. People have said, what do you mean? Everyone lives in a house that's got some mold in it. Yes, but there are a few molds that are the ones that are producing these mycotoxins that can damage your brain. Many don't, but there are a few that do. The big ones are Stachybotrys, Aspergillus, Penicillium, Chaetomium, and Wallemia. Those are the big five to know. And the EPA put out what's the so-called ERMI score, which is the Environmental Protection Agency's Relative Mold Index, ERMI. You can get it online, and it's like a little Swiffer duster sort of thing. You can get it, for example, from Mycometrics. There are other groups as well. And you can, and I have nothing to do with Mycometrics, so we're just looking at how do we get best outcomes for everybody. So if you do that, they'll tell you how much of these bad guys you've got in your house. And you can also have your doctor measure your mycotoxins in your urine to see,
Right.
and you also can have your doctor measure in your blood, do you have antibodies to these things? So when you're talking about organisms, as you mentioned, yes, it's mold species, it's other, it's yeasts like Candida, it is spirochetes like Lyme disease, tick-borne illnesses, Borrelia, Bartonella, Babesia, anything that's causing your brain to respond and have to fight these things. What's been fascinating to see, the amyloid that we vilify in Alzheimer's. People say, well, you got amyloid in your brain because you have Alzheimer's. Well, the amyloid is there because what does it do? And if you've ever seen those insects in amber, they're trapped
Oh,
inside the
yeah, yeah, yeah.
and these can be, millions of years old, amber, like back from dinosaur time.
Right.
That's what amyloid is. It sequesters and it removes these things from bothering your brain. So you can actually have this amyloid sitting in your brain for 20 or 30 years without having a problem. When it gets exceeded, in other words, what happens is that's like a first line of defense. Imagine you have a town instead of your brain, you're thinking about a town. And imagine you have, one burglar who enters the town. Okay, so if you can sequester that burglar, put him in jail, the town can still go on and do what it does. There's no major problem. But now, if you've got 1,000 and they're burgling everything and everything, you got to send out you got to send out the whole police force. You got to shut down the town. What the heck is going on here? That's exactly what you see in the brain. As long as it's very low level and you don't have a lot of inflammation, you can sequester these various insults and these various pathogens, and you can still think normally. When they exceed that structure, you got too much exposure or you got a big response to them with inflammation, that's when you're starting to lose those synapses. That's when you're getting those symptoms. And in fact, the pathologists have noticed this for years. It's that inflammation, the microglial activation that's associated with the symptoms.
Stress has to be a big factor too in all of
Yes,
this. And we live in a pretty stressful world these days. And unfortunately, the I saw a statistic recently that the number one cause of death for I forget the age group, but it
yeah,
was young people, has is suicide.
yeah,
And
yeah.
I was just shocked by that.
Yeah.
And so we've got to figure a way to be in this world without being so stressed. And
It's so true. And I used to,
meditation or whatever it takes.
yeah, I used to poo-poo this as a scientist. I say, big deal. Everyone's under stress. But I was wrong. It turns out that that is a very common, and by the way, it's one of the major contributors. We have the three top ones are the ones I mentioned. Then there are the three lesser ones. Stress is an important one. Neurotransmission, so things like having enough acetylcholine, and trophic support, having enough hormones, enough nutrients, and enough neurotrophins. You mentioned BDNF earlier. That's an absolute key one to keep your brain thinking well. If you just have stress with your cortisol going up, that is associated with brain shrinkage. You get brain atrophy in association with stress. So it is absolutely an important player. When we were trying years ago to develop drugs for Alzheimer's disease, it turned out that one of the targets that is associated with the amyloid and the tau of Alzheimer's happens to be a stress receptor. It's called corticotropin releasing factor receptor 1. So CR1 is critical for your brain shrinkage and for your amyloid and tau production. So what I do, everyone should be checking their heart rate variability. See if you want to when you're going you're in good shape, you're in the connectivity part, the connection rather than protection. As I said, a whole bunch of things change with there, all sorts of biochemistry changes. And one of the things that changes is when you switch from connection to protection, you go from parasympathetic with a nice high heart rate variability to sympathetic. Your heart rate variability goes down, your heart rate goes up, your adrenaline goes up, your brain shrinks. You have more high blood pressure. You have more tendency to thrombosis. Your body is literally saying, "Oh my gosh, I'm being assaulted. I've got to protect myself." So that again, and you can get there by just eating a bunch of junk. That will push you more into that sympathetic drive mode. It's trying to protect itself. So you're right. Stress is a key player.
Yeah, I've been telling people lately in my coaching, calm is your new superpower.
Yeah.
If you could figure out how whatever it takes for you to be calm, walking in nature, doing some deep breathing, meditation. Number one, your decisions are going to be so much better coming from that place because when you're in that fight or flight high beta brainwave, usually those decisions, other than, if you're being chased by a wild animal, I'm talking,
Yes.
is those decisions are going to be great because they're coming from that place of angst
Yeah.
versus being able to really critically think through a situation when you're calm. So there's a big difference.
But you also have to remember. So, one of the things that comes up a lot is people say, well, I'm just going to make sure I have anti-inflammatories. I'm going to get rid of the inflammation and I'm going to get rid of the stress and I'm going to make sure I'm calm. Well, when you get rid of the inflammation, make sure you're getting rid of the cause of the inflammation. We
The
want to go
root
upstream, get
cause,
rid of the causes, the root cause. If it's because you have poor dentition, let's get that dealt with.
right?
Maybe you need a rinse or an oral microbiome change, whatever it is, some oral probiotics. Maybe you have a deep abscess that you don't know about. Same thing with stress. If you're doing some forest walking or forest bathing, as they say, try Shinrin Yoku, or you're trying to be calm, make sure that your stress isn't because there's something that's actually causing this. It
Right.
may be that your stress is appropriate. Someone is denigrating you or attacking you. You want to also
Very
get
good
rid of
point.
the cause of the stress. If you're in a toxic relationship, reevaluate that. Maybe you want to go to a therapist, whatever it is. get rid of these upstream, because these are the things that are telling your brain you've got to go into that protection mode. They're getting you out of that connection mode. You want to be able to get back into that connection mode. You think better, you sleep better, all those sorts of things.
Yeah, I'm glad you brought this up because I totally agree. It's not just okay, I'm going to be calm now and everything's going to be perfect. You've got
Yeah.
to get to why you're getting so stressed to begin with.
Yeah.
And
If your house is on fire,
yeah,
you don't want to be too calm.
no, no, no. So that's really important. Um, and we know exercise is a big part of this too, and keeping yourself active in some way, whatever works for you, you know.
Yeah.
But
And
what
and part of it is just happiness. But as far as exercise, again, just like with sleep, there are key parameters, at least 7 hours, at least an hour and a half of REM, at least an hour of deep sleep, and at least oxygen concentration of 94%. For exercise, it's the same. You want to get that heart rate up, and you want to do it, at least 5, 6 times a week. People will say to me, well, I do a little bit of walking. Well, okay, that's a good start. You got outside, that's great. And you got the heart rate up a little bit, but you want to push it a little bit. Don't give yourself a heart attack,
right,
but push it a little bit and then you want to get oxygenation. You want to get both some aerobics and some strength training. The strength training helps with your insulin sensitivity, whereas the aerobic part helps with your oxygenation and your blood flow. So you want to combine those. Some people really get great benefit out of EWOT, exercise with oxygen therapy, where you're doing like a cycling, but you're doing it with 100% oxygen. That's very helpful to a lot of people. Other people will like to use Katsu bands, these restriction bands, which
mhm.
basically give you more bang for your buck. For people who have joint issues, that's a great way to go because you don't have to do as many reps, and yet you get the great benefit of that.
Yeah,
So,
I
yeah.
have a really good story about using those bands.
Oh,
Is
good.
I had a chronic shoulder issue, which I've had for years, and I thought there's no way I'm going to get a shoulder replacement or any of that, you know. And my personal trainer, she said, we're just going to use the bands,
Yeah.
and it worked.
Yeah.
It absolutely worked. It was amazing. And I have to be careful. I can't lift anything too heavy because
Yeah.
it's a weaker part of my body. But I mean, it was like night and day after doing those bands for 6 weeks. So,
Yeah.
and how simple is that? You can buy
Yeah.
them for $10 and put it
Exactly.
on the doorknob and do that.
Yeah, it's so there, the as I say, the armamentarium for brain health is growing dramatically. Another one people like is Origin. Again, I have nothing to do with Origin, but I know that people have been getting good results with it in our ongoing clinical trial. Origin is AURAGEN. It's one of the forms of light therapy. V-Light has done a great job as well. That's VIELIGHT. They've done a great job. Neuronic
Is
is
that
another
red
one.
light? Is that red light
Red light.
therapy?
Yes, this
Yeah.
is red light. So all of these photobiomodulation, again, another thing that I thought, come on, is this really helpful? It's turned out to be quite helpful for many people. There's a group now developing mitochondrial transfusions. Very promising, very interesting, not clinically available yet, but I think it's going to be interesting. People are realizing, okay, here's what it takes to make your brain strong for your whole life. And so, again, very few people should have to deal with cognitive decline and even brain fog. We're seeing so much brain fog associated with COVID and even associated with COVID vaccines,
Mhm.
unfortunately. And there's a lot you can do about this now. Get rid of that brain fog to get on to being sharp. You don't want to leave the brain fog because it's already been shown that people who've had COVID are at increased risk for Alzheimer's disease. It is yet another source of a chronic inflammation of the brain. So again, more and more that can be done with optimal nutrition, optimal exercise, optimal sleep, stress reduction, brain training. Once you're doing the right things, having some form of stimulation, and that includes the light stimulation I mentioned, but also brain training can be very, very helpful. And then some basic detox, very helpful. I see so many people who have been exposed to toxins, they don't even know it, and their glutathione is quite low. Glutathione is a very important protection, detox, and antioxidant for your body. And so it's a shame to let your glutathione get too low. You can get it evaluated easily. Your doctor can do that one for you. You can even do it, online, easy to do. And you can go to like My Cognoscopy, any of these things, get it checked, and do things like sulforaphanes, broccoli, things like the crucifers. Very, very helpful. Of course, organic vegetables, you don't want to get a lot of toxicity, can be very helpful to help you clear these out. A high fiber, high phytonutrient diet can be very helpful. My wife, who's an integrative physician, says, your tub is full. Over years, you've gotten so much toxicity, you just can't take anymore.
Yeah.
And so you've got to kind of keep emptying that tub. Dr. Neil Nathan has done such a great job with a wonderful book that he wrote called The Sensitive Patient's Healing Guide. And he points out the same thing. You get the onslaught of all these things, and you just get to the point where you cannot handle anymore. And so you then develop this high sensitivity to chemical toxins, sensitivity to even to EMFs that you mentioned earlier, things like that. And by the way, I saw a very interesting presentation from Dr. Heather Sanderson. Worked with Heather for years. She's the one that started Marama, which is an assisted living that uses our protocol very successfully. She had a woman who was going to get some hair dye, and she checked toxin levels for multiple toxins before and after the hair dye. And you could see this striking increase after the hair dye. So again, to
Women
the
do not want to hear that.
I know. And so, okay, get ones that are more natural if you can.
Yeah.
Talk to a cosmetologist.
Yeah.
Get ones that are going to be more friendly. And then, by the way, don't worry about it. Get your glutathione up before you get it. Get your glutathione and vitamin C and these detox things up before and after. It's the same thing when you go in for anesthesia. Get your detox going well before the anesthesia, boost it up after the anesthesia, and the anesthetic agent won't give you as much problem.
You
Just
know,
remember,
I
let
did
that
that very
go.
thing. I recently had a nose issue where I couldn't breathe out of the left side of my nose, and so I was really hesitant because I had to have anesthesia. And so I knew what to do. I made sure, that my glutathione levels were up and, my vitamin C and all that prior to. And then 3 days, I had a bad reaction to the anesthesia, by the way. I think my body just said no,
Yeah.
because I eat pretty clean, and that went in and it was not fun. But on the third day, I went and I got an IV glutathione.
Yeah, good.
And it was like I was 100% better after
Yeah.
that. So I'm a firm believer in the glutathione.
Yeah. Isn't it amazing? People, when they have toxin related problems, intravenous glutathione, and often done glutathione with some phosphatidylcholine, some PC,
Yeah.
they'll notice a huge change. We'll see people where they really have significant cognitive decline, and it'll turn out that toxins are a big piece of it in many people. When they get the IV, for the rest of that day, they'll notice, wow, I'm sharper. And then, by the next day, they've had a little bit of back, but they'll over time, with repeated, they'll kind of ratchet up and get better and better. So
Yeah,
yeah,
and that may be something that some of our listeners don't think about. And I think that it's pretty common. You can find it in most cities now, a
yes.
lab or someplace where you can go and you can get high doses of vitamin C, glutathione, and other things that can really assist you in your health.
Absolutely. And in fact, for those who are really heavily affected, there's something called PK protocol, also called Hyman protocol, where they do this combination of glutathione and phosphatidylcholine with a couple of other things, a couple other vitamins and things, but they actually works quite well. They do it twice a week for 11 weeks, and they show dramatic decrease in toxins. We're also seeing very nice data in people who undergo plasma exchange. over 70% reduction in a number of these different toxins, including, by the way, microplastics. And
Wow,
so
that's
these
interesting.
things, again, it makes a difference.
Wow. Well, there's so much more in this book, which, we could talk for hours, but
Yeah.
we can't do that today. But I highly recommend The Ageless Brain. And if our listeners want to learn more about your work and what the latest and greatest is besides getting the book, how can they find you?
Yeah, lots of places. You can look. There's a documentary on Amazon Prime, which was narrated by Michael Bublé, which was called "Memories for Life: Reversing Alzheimer's." There are the books that you mentioned. You can go on Dr. Dale Bredesen on Facebook or Instagram or X or Blue Sky, any of those things, and see what we're up to. You can look at Judy Walks and see where Judy is going across the country. So there's
Apollo
lots
Health?
of ways to get information. You can go to
Apollo.
apollohealth.com. Apollo, fantastic group from Silicon Valley. Lance Kelly, who's the CEO, worked at Apple for years, and we've all worked together to really for the future of medicine. We need to put these algorithms together. The computer, it can help us to get much better insights into what's going on to drive change in your brain. They have a whole community of thousands of people who are following this work and who are doing very, very well. We have such wonderful stories. People, one of the doctors told me the first time she saw a reversal of cognitive decline and she started using this protocol, the doctor cried. So it is amazing to see.
Yeah.
And really, we're getting to a point where everyone should be avoiding cognitive decline.
Yes. Well, the research is exciting, your work is exciting, and it's much needed. If, almost everybody knows somebody that has Alzheimer's or Parkinson's or one of these neurodegenerative diseases. And after talking with you and seeing all the latest research, we can do something about this.
Yeah,
But we
absolutely.
need to start now.
Exactly. All right.
So
Well,
thank
great
you for
talking with you,
being a
Carol.
guest.
Thank you so much as always. Always enjoy talking to you.
Me
Keep
too.
getting the word out.
I
Thank you.
learn so much when I have you on here, and I hope our listeners do too. So thank you to all our listeners, and everybody have a great day and eat organic and listen to the show, and you'll be fine. Thank you so much. Bye
Thank
bye.
you.